Hey, it's Jessica DaMassa with WTF Health. I'm here at the Together.Health event at HIMSS 19, and joining me right now, I have Maura Little. She is the Executive Director for Cambia Grove. So Maura, welcome. It's a pleasure to talk to you.
Thank you. It's a pleasure to be here.
All right, so give us an update about what's happening. I know you guys are based in Seattle, but you're like conquering slowly the northwestern part of this country in terms of health and innovation. So give us a sense of what's happening in Cambia Grove. Your model is a little bit different than a typical accelerator, incubator, co-working space. So explain for everybody who's listening.
Sure. So Cambia Grove is a healthcare innovation hub where we focus on bridging the gap between entrepreneurs and the traditional healthcare system, truly to make it easier to innovate in healthcare.
And you are backed by a healthcare system.
We sure are. We are fully funded by Cambia Health Solutions to be a neutral convening zone.
Neutral convening zone. Break that down for me.
Neutral means no selling from the Cambia Grove.
Okay.
We bring competitors in the market together all the time to talk about some of the common denominator issues that we all need to solve around to advance healthcare innovation, to be more person-focused and economically sustainable.
Okay, and when we talk about common denominators, from your vantage point where you guys are at, what are you focused on? Give me some specifics.
Sure. So Cambia Grove, you can think of us as one part incubator, where we do a ton of programs and events. We host a open, neutral convening zone, free and open to the public, 9 to 5 in Seattle. But then, so that's one part incubator. The second part is a think tank. And so really what we try and do is bring together the community to solve those common denominator topics through convene, identify, and catalyze solutions that are preventing innovation from flowing freely. The first topic we chose was data.
Okay.
Data is a big one.
Obviously, yeah.
Yes, obviously. So what we did was we convened almost 100 stakeholders to talk about what the barriers are in using data in healthcare innovation.
Okay.
And what we came up with was almost 20 projects that the community can come around to advance data in healthcare innovation. The first project that we tackled was what we call the Data Resource Directory that lives on the Cambia Grove website, and it's literally a list of data resources that are available to entrepreneurs and change makers alike to innovate in healthcare.
What do you mean by data resources? Like, is this like open sets of data that they can access, or like what's on that list? Like, give me a specific, for all my data friends who are data nerds that are watching. Tell us specifically, kind of give us an example of what's on there.
Sure. So we launched it with two organizations, HHS.gov. So healthdata.gov was the first one that we launched with. They became a partner, and they literally filled out a tile to say, here's what data is open and accessible to folks if you want to innovate and use our resource. The second one was the Fred Hutchinson's Cancer Research Center submitted the Hutchinson Institute for Cancer Outcomes Research, which is exactly, it's a robust data set to
Got a robust name.
It is. It's high core for short. So it's a data set that people can use to help advance innovation in cancer. We also have a smart synthetic data sandbox that's really exciting. And these are all things that are available already to the community, but you can't just Google healthcare data.
Healthcare data sandbox.
Exactly. It's a list. It's a curated list of data resources that people can peruse.
Is that available to everybody, or just people who are working in your space?
It's available to everybody.
Okay.
And let me be clear, it's a list, and it showcases what data sets are available, and then you go to the organization like Fred Hutch.
We got it. Okay. All right, cool. So, all right, backing out of this a little bit. Yeah. So that's a very helpful resource, but I'm curious to know, as you guys are, obviously you're backed by Cambia, right? And so, what are some of the challenges specifically? I guess, do you have a thesis that you're working on, trying to develop companies in certain areas? Or are you scouting for certain things? And if so, what are some of these things that you're looking for?
So, that's a great question. For Cambia Grove, what we're trying to do is raise the level of innovation in healthcare at large.
Okay.
And one of the things that we've done recently to raise that level of innovation is to define what we're talking about.
Okay, well, yeah, that's helpful.
Yes. And so in January, what we did was we launched the Utah Healthcare Innovation Landscape Report that defines healthcare innovation in a vertical versus looking at it kind of this piecemeal type sector-based way to define it. And what we did was we defined it in a vertical to look at traditional healthcare, expanded healthcare, and healthcare innovation.
Okay.
With traditional healthcare, it's defined as the 5 points of healthcare: payers, providers, purchasers, patients, and policymakers.
Okay.
But what we zeroed in on was the healthcare innovation, and we categorized it in digital health, health IT, life sciences, and innovative services. Okay. And so that was one of the things that we did to level the playing field, and we'll continue to move forward, but we had to take step one before we took step 5.
Sure, to bring some order to this whole mess that we're calling health innovation at this point. Yeah. All right, cool. So is there any, I mean, as far as like what's hot and what's not to you guys, is there any area that you're not looking at as much anymore? I mean, like anything that you just feel like it's solutions that are coming to you that are dealing with a particular type of technology or trying to solve a particular problem that is no longer of interest, you guys have kind of moved on?
You know, it's, with Cambia Grove, we're not so focused on a certain area of investment for Cambia Grove. Now, right. Cambia Health Solutions has a number of organizations under the umbrella that do have specific targets. For Cambia Grove itself...
You are kind of hunting ground, though, aren't you?
You know, we're not. We're neutral. Okay. Yeah. Right. No, and
maintaining neutrality.
It is. We are neutral. We will, we love having startups come into our doors to understand what's going on, and we love to be able to help those startups. For Cambia Grove, we're there to help.
Okay. And right, so what are you not interested in then, as far as like the startups that are coming in the door? What's not a right fit?
What's not a right fit, and what we've seen at large, and what we're trying to reverse is those technology solutions that are hunting for a problem to fix. We see that time and time again. And so one of the ways that we're trying to combat that is by interacting with the 5 points of healthcare to really dig in deep and understand what are those nitty-gritty problem sets that they need help solving.
Good. So you're pulling the problems out of the traditional healthcare players and then bringing that to the startups rather than having a startup say, I have blockchain, let me fix something.
Exactly.
Got it. All right, and so what's if that's what's not hot, then what is hot right now? I mean, beyond having like a good problem to solve, but is there any area of technology that you're particularly focused on? I mean, are you looking at mostly data solutions? Are you looking at things that are using like AR, VR? Are you looking at wearables? Like, what are you looking on? Or is there one problem that you're like, man, we are focused 100% on opioids, or like what is it that you guys are looking at?
You know, we are again, we don't necessarily look at those, but they come to us. The things that we've seen that have gotten traction and are really doing some incredible things are those data-related solutions that are able to partner with a traditional healthcare system, one of the 5 points, to make people's lives easier, honestly. Okay. Some of the companies that have come out of the Cambia Grove, that's used the Cambia Grove in the past, are companies like Kensai. They just raised $22 million. Yep, super excited about what Kensai is up to. Super excited about some other companies within Seattle. It's hard to say because we are neutral. But I would say in the Seattle region, a couple of other companies that have started to really catch fire are 98.6. Okay, yeah. 98.6 is doing a ton of work that are really taking primary care to the patient. But honestly, we've got the data, using data for good has been one of the things that makes us most excited.
I want to ask, last question for you. You know, you've got some very famous big tech company neighbors up there in your neck of the woods in Seattle. So are you doing any work with them? I mean, and if so, it's like, in the spirit of the Together.Health event, talking about bringing together different players in the healthcare ecosystem, especially the innovation ecosystem, you can't leave out like Microsoft and you can't leave out like Amazon. So, I mean, talk to me about like how you guys are working with them, if at all.
So we are, and we work with them just as we do with everybody else. Okay. It is understanding what their biggest challenges are, understanding what they would like to see in healthcare and innovation in the future.
Can you give us a tip?
I can't.
Gossip?
Oh my God, well, neutrality. I know. I'm so sorry. It really is. It's everything that we continue to talk about.
Well, that's good. At least we know that they're working on the same stuff.
Yeah, I mean, it really is. We hosted a startup day with HHS in June, and we brought all of those players together. Yeah. And, the biggest obstacle that is the lowest hanging fruit out there that we do tend to focus on is the fact that there are so many resources, there are so many people, there are so many opportunities out there. It's that connection point that's missing, and it's that connection point and that defining what healthcare innovation is and who the players are around it to make the most impact. That is what Cambia Grove focuses on.
All right, Maura, thanks so much for joining us. It's a pleasure to talk to you and pick your brain, and way to go on maintaining that neutrality status all the way to the very end. But also giving us some great insight. I appreciate it. I'm Jessica DaMassa with WTF Health. Thanks so much for watching.